All right, we're going to get started. If there's anybody I haven't gotten yet, I will go through the list again and make sure that I've gotten everybody clicked to allow to record. Once again, this is Lynn Sutphin at the Michigan Department of Health and Human Services. We have a presentation today on the Michigan Interim COVID-19 vaccination strategy. Our speakers today will be MDHHS Director Elizabeth Hertel and Dr. Jonay Caldoun, our Chief Medical Executive. At the end, there will be a brief period for some Q&A, so then we'll go through that at that time. Please make sure you are on mute. You should all be, but just to make sure of it, please. And I'm going to turn this over. I believe, Elizabeth, you are going to kick this off.
Thanks, Lynn. Are we all set to go?
Yes, ma'am.
Okay. Thank you to Lynn and Doris and our communications folks for getting this set up today, and to all of you for being able to join us this morning as we, Dr. Caldoun and I, walk through our vaccination strategy for the state of Michigan. I'd also like to thank Dr. Caldoun and her great team and others in state government for putting together this great presentation. It's full of a lot of information, and really proud that we're able to explain our planning in this fashion. So we're currently operating under some guiding principles that will keep us working in the direction of achieving our goals. First and foremost, of course, all Michiganders have equitable access to vaccines. We are working on ensuring that our planning and distribution is inclusive, and that we work actively with stakeholders and partners in the communities to ensure that we are identifying the appropriate populations and the best way to reach them, that we are communicating in a transparent way and offering accurate information to individuals across the state. We also rely on data to promote our equity, track progress, and make sure that we are working toward our goals in a positive way. And of course, always at the Department of Health and Human Services, we're working to use our resources as efficiently as possible in order to achieve these goals. We are looking to make sure that 70% of Michiganders age 16 and up, those are the individuals that are eligible to get the vaccine in general, are vaccinated as quickly as possible, because we are currently working with vaccines that require 2 doses, that 95% of people are getting their second dose in the expected time frame, and that when doses are distributed, that 90% of those doses are administered within 7 days of receipt. We're also looking to ensure that there are 0 disparities among the populations who are receiving the vaccine, and that people have access to the vaccine. They shouldn't have to travel more than 20 minutes in order to reach a vaccination site. We are currently relying on the Social Vulnerability Index, which is published by the CDC, to help us navigate and ensure that we are targeting the appropriate geographic regions in the state when we are focusing on those who we know are more vulnerable for transmission of COVID-19. This index is comprised of 15 social factors among a variety of areas, as you can see: socioeconomic status, household composition, minority and languages, and then access to stable housing and transportation. The status in Michigan communities correlates extremely closely with the communities that were hardest hit by COVID-19 in the spring. We have been operating under our allocation strategy for a few weeks now, and that relies on a few important elements included in that formula. First, we are ensuring that we have a flexible allocation so that we can target special populations, primarily communities of color and underserved areas. We are working toward an equitable allocation across all of the hospitals and the local health departments, currently under the priority 1B population as defined by the CDC. We are working under the baseline population of the local health departments, numbers for those 65 and older, as well as identified essential workers included in 1B. For the hospital allocation, we are looking at the percent of inpatient visits of those 65 and older from 2019 to help us determine the appropriate allocations. We also then weight those by the social vulnerability index and then apportion the vaccine by type, currently either Moderna or Pfizer. We are asking and working with our partners to develop their own strategies to target outreach to those zip codes that we've identified that include at least one of those high risk factors. And this is a sample of what we would be looking at and how we would be targeting those. I love this map because it's so busy. This is obviously the state of Michigan. The shading indicates the social vulnerability index geographic regions. So those that are darker are higher, lighter obviously are lower. And then the different shapes on here indicate the number of local health department vaccine clinics that have been completed or planned. And then the size of those graphics indicates how many vaccines were allocated or administered at those clinics. And this map indicates all of the clinics that have occurred outside of the local health departments, with a number of our other provider partners, as you can see, ranging from home health providers, hospitals, to urgent care centers. This is currently the vaccination schedule under which we are working. This is dependent on the allocations coming into the state of Michigan. Based on the allocations that we have received previously on a weekly basis, this is how long we believe it will take us to ensure that 70% of Michiganders who can get a vaccine will get one. So you see that ending toward the end of December. But we have been working very closely with the Biden administration, as other states have as well, to facilitate the increase of the allocation quantities that are coming into each state. And so this schedule is certainly subject to change as those allocation amounts change. And I will turn it over to my colleague, Dr. Khaldun, to go through in a little bit more detail the strategies under which we are working to implement this plan. Dr. Khaldun?
Yes, thank you, Director Hertel. Really excited to put forward this strategy and grateful for the dedication and hard work of our entire team, especially Dr. Ryan Callow, as well as Bob Swanson, who is our Director of our Immunizations Program. So our first strategy, and there's 5 of them, they all align with the Biden administration's COVID vaccination plan. Our first strategy is simply to get more people vaccinated. We want to expand our capacity as much as possible and absolutely prioritize those who are most vulnerable to severe disease, but also those who are vulnerable to exposure because of where they may live or where they may work. I'll say right now, I'm very proud that we have capacity to vaccinate up to 80,000 people a day in the state. And our biggest limitation is really the amount of vaccines coming into the state. So how are we going to do this? Really, it's working really closely with our local health officers. They are the chief health strategists across the entire state. They know their communities well, working with them to support FQHCs, mobile clinics, school-based health centers, and other community vaccinators to specifically target vulnerable populations for vaccinations. And I'll say here, it's really important that we look at not only how we're allocating the vaccine across the state, but also what's happening on the front lines as far as those strategies to get into neighborhoods and really address barriers to access for vaccines. So as part of that, it also means utilizing EMS, mobile strike teams, and other vaccinator partners, again, thinking about disabled, the migrant or transient workforce, and other marginalized communities. We want to make sure no one has a barrier to access because of language or cost. And of course, using social vulnerability index in the vaccination process as well. So we want to get shots in arms, but to do that, we also have to really build a robust network of vaccination sites. We want to make sure Michiganders have equitable access to vaccines. If you go back to one of those goals that Director Hertel talked about, we don't want anyone, whether you're in an urban area or a rural area, to have to go more than 20 minutes to get to a vaccination site, and that's really, really important. So we have plans to create mass vaccination sites in each emergency preparedness region, working with our local partners and the Michigan National Guard. The National Guard has been an incredible partner for vaccination efforts across the state, but also throughout this entire pandemic when it comes to testing and logistics as well. We really think at least one of those mass vaccination sites in every emergency preparedness region should be 24 hours. If these vaccination sites are only 9 to 5 when people have to work or tend to their day-to-day activities, it's really difficult for them to access the vaccine. So we do want there to be 24/7 access. We are already working with pharmacy partners across the state, engaging with FQHCs as well. Again, really thinking about equity when it comes to both urban and rural citizens being able to get access to the vaccine. We've had great success with neighborhood-based testing sites across the state, so we will be building upon that success and engaging with vaccinations in those sites as well. And of course, again, you'll see a lot of focus on marginalized and hard-to-reach populations, so that includes the incarcerated, disabled, and those who are living with substance use disorders. So this is more of strategy 2. Again, this is really, really important. Leveraging existing non-traditional spaces, whether it be a casino, a barber shop. We have syringe service programs that we've been expanding as part of our opioid strategy across the state. Even if we are unable to get vaccines into those places, the vision is really to engage with people, meet them where they are, bring educational materials into these neighborhoods so that people can get information about the vaccine. Leveraging rideshare programs to address transportation barriers. I've had great success in other jobs, partnering with Lyft, for example. That's just an example, to be able to make sure people get access to the vaccines and don't let transportation be a barrier. Leveraging emergency departments as vaccination locations. I'm a practicing ER doctor. There are many people who come into the emergency department who otherwise may not have access to the healthcare system. So as we get more vaccines, and unfortunately, we don't have enough in the state right now, but as we get more vaccines, emergency departments could be an excellent place for people to get vaccinated as well. And then of course, leveraging primary care clinics and FQHCs as vaccination hubs. Our third strategy is promoting efficiency in vaccine delivery and administration. Again, this aligns very well with our goals, especially that goal of 90% of vaccines that are received by a facility being in an arm in 7 days. I'd say I think this is really where Michigan has done well over the past several weeks. That's why we've gone up in the rankings when you compare us to other states. We maximize our federal allocation. So the vaccine that's available to us, we draw down as much as we can, and we get it out into our communities with our providers. There is no centralized place in Lansing where we're keeping a freezer of vaccines. We're getting it out to providers so that they can get shots in arms. So with that, that means promoting frequent communication, transparency in our allocation process. That's part of this presentation today. Leveraging public and private partnerships, engaging stakeholders in the allocation process as well, being responsive to address distribution challenges and needs. This is the most massive vaccination effort that anyone has ever undertaken. And so there are bumps and there are challenges. And so we are really committed to working with our partners on the ground to make sure we're helping them work through those challenges. We're also maximizing administration throughput by allowing demand to exceed supply. We fully recognize, and it's unfortunate that everyone who is eligible for a vaccine today can't get one, unfortunately, because we simply do not have enough vaccine. We continue to advocate for that at the federal level. We've been pleased in the past few weeks, we're getting additional vaccines, an increase in about 20% into the state, which is really, really incredible. And we'll continue to look for more vaccines coming into the state, especially as we see additional vaccines such as the Johnson & Johnson one on the horizon. The fourth strategy is about mobilizing personnel. We of course need people to be able to put these shots in arms. So really leveraging our human resource capital across the state. We're already doing this by working with EMS. We do have a volunteer registry that is already being engaged across the state. Local health departments are also engaging volunteers as well. We also think leveraging our clinical students, it could be a medical student, pharmacy student, and others, to really be able to help us get personnel who can put shots in arms. And of course, expanding use of the Michigan National Guard, who has just been an incredible partner throughout this. And then finally, education is incredibly important. We want to empower people with information so they can gain confidence to be able to get vaccinated. We already have a robust earned and paid media strategy to address vaccine hesitancy. We're targeting communications efforts to areas that have the highest vaccine hesitancy rates. So town halls, op-eds, we're really building out a coalition of individuals who can be in their communities, really bringing that message of the safety and efficacy of these vaccines. We were pleased a week ago to have the first meeting of our Protect Michigan Commission, more than 60 leaders from across the state, bipartisan, multiple different sectors, really who are going to be boots on the grounds, bringing that message again about the safety and efficacy of the vaccines into the community. Also leveraging and improving our technology platforms so that we can improve and ease people being able to get scheduled. We know that our local health departments have websites and phone numbers. We're partnering with 211. We recognize that not everyone has access to a computer or knows how to use a computer. So we are partnering to make sure our elderly, for example, can also get access to a scheduled appointment. And we're also working to make available our race and ethnicity data when it comes to our vaccination efforts. Again, we really want there to be no disparity when it comes to our vaccination efforts in the state. So with that, I will stop, and Lynn, I'll turn it back over to you.
Thank you very much, Dr. Khaldun. So we're going to have a brief time here that we can do some Q&A with our speakers. If you wish to ask a question, please raise your hand. I will call on you. Once I've called on you, please introduce yourself and your outlet, as well as ask your question. You will be limited to one question. If we have time, we'll get back to some follow-ups, but one question, please. I will call on Christina Ford. Can you unmute yourself and ask your question, please?
Yes. Hi, this question is for either or. Do you guys feel like the characterization that so far the rollout and distribution has been disorganized for the general public, not working at the hospitals? Do you think that's accurate or fair? We've heard from dozens of seniors who say they still haven't gotten any information about how they can be vaccinated, and they've signed up.
I think the real barrier that Dr. Khaldun and I both emphasize and think about constantly is the amount of vaccine that's available. And once we are able to start getting quantities into the state that ensure everyone who wants a vaccine can get one, then we will see a lot of those issues disappear.
Thank you. Next question, Kelly Rainey. Please unmute yourself and ask your question.
Yes, hello, good morning. I was just wondering, now that we are finding the B117 variant here in Michigan in a few different counties, including Kalamazoo now, I'm just wondering how that's impacting this vaccine strategy and the need to get more vaccinations and shots in arms.
Yeah, I can take that one. Of course, we're very concerned about these new variants. We have identified the B117 variant in the state, but we expect there to be more and potentially other variants, the Brazil variant, the South African variant in the state. I think it's more and more important that everyone gets vaccinated as quickly as possible. Again, we have built out capacity to be able to do that. And right now, our biggest challenge is lack of supply of the vaccine. The more we vaccinate people, the less this virus will be able to spread from person to person and to have the opportunity to mutate. So that's why it's even more important that we are vaccinating as quickly as possible.
Thank you. Mike Wilkinson from Bridge, please unmute yourself and ask your question.
Hi, good morning, Dr. Khaldun. I think you might have the best answer for this. Is You mentioned going to places where people were, meeting them in casinos or in barbershops, and I wondered, there's been some reports that I think the research has shown that some minority communities have been apprehensive. I know we don't have yet racial data on the vaccinations. Apparently that's going to come out soon, but from what you know, what are we seeing in Michigan from looking at the MICR data? Has there been a disparity? Have communities been less likely to take the vaccine, or have they just not had the opportunity to do so? Thank you.
That's an excellent question. So we're very concerned. We had some preliminary data from a survey back in November. I know we're going to be doing more surveys and focus groups in the upcoming months. But absolutely, we know that Black and Brown communities across the country and here in Michigan are more hesitant to take the vaccine. I think it's important that we recognize the reasons for that. It's the United States history, the fact that there's been experimentation on Black and Brown communities, and the fact that there still exists racial implicit and explicit bias in our healthcare system today. So I think it's important we understand the why, and that we don't shame people for being hesitant. But part of our strategy, again, strategy 5, is really making sure we are making opportunities for people to have those conversations, making sure we're working with trusted community leaders to really bring that message into the community. But there's no question, I'm sure that hesitancy is absolutely a challenge in the state, and that when we do really get robust data, we're going to see that there's fewer Black and Brown individuals who are getting vaccinated.
Thank you. Jordan from Gongwer, please unmute yourself and ask your question.
Hi, Jordan Hermany with Gongwer News Service. I just kind of wanted to go back to the timeline that was shown a minute ago about the interim vaccination schedule. For everybody who is not one of the high-risk populations or the elderly populations, is it then safe to say that we should not expect vaccination efforts to take place for these individuals until October, November-ish? And is the department doing anything to kind of address recent reports of quote unquote line skippers? I know that the guiding principle has been a shot in an arm is not a wasted shot, but I do understand that there has been some displeasure with the idea that local community leaders who otherwise would fall into that later vaccination schedule are maybe using their status as a local leader to get a shot before somebody who may need it due to their age or their health status.
We are allocating based on the priority populations is recommended by the CDC. When we send those, or when we request and those allocations are ordered and distributed, the providers who are receiving the vaccine know that we are operating under those priority populations. For the most part, I think that we have heard some instances of like this. And when we do hear those things, we talk to and work with the local health departments to understand the reasoning behind some of those decisions. But we are, at this point, we are still operating under the priority population recommendations as defined by the CDC.
Maybe I'll just add, that's also part of why the allocation strategy is important, but it's also what people are doing on the ground when they do have their vaccine and going into neighborhoods and reaching those who are most vulnerable. I'll also add, I think your first part of your question was about the calendar. That is something that's interim, and it's based on the amount of vaccine that we're getting into the state today. We just all learned last night, actually, that Johnson & Johnson has submitted their application for emergency use approval. We have even, over the past couple of weeks, gotten an additional almost 20% allocation into the state of the vaccine. So as we get more vaccine, I do expect that calendar to change and for populations to be able to be vaccinated sooner.
Thank you.
Thank you. Shanley, can you unmute yourself and ask your question?
Absolutely. Thank you, everyone, for your time and for the opportunity. Elizabeth, Director and Doctor, and Jordan also, and Lynn, thank you so much. Okay, my question is this. What can seniors statewide, especially let's focus on Wayne County right now, when health care, we focus on Wayne County. The county is asking seniors to go to their health provider. The providers this week are saying they have fewer doses and the seniors can't make that online appointment Right now, they feel like there's nowhere to turn. What's the first thing a senior could do today to turn that around for them?
We would recommend that they contact 211 and work with the 211 providers and call center to help facilitate either making an appointment or being able to get onto a waiting list to make an appointment.
And 211 is up and running today for that service?
It is.
Thank you very much.
What if they don't hear back?
Hey, Paula, can you unmute yourself and ask your question?
Yes, thanks. This is Paula Pash from the Oakland Press. Has there been a change in allocation between hospitals and health departments in recent weeks? And if there has, can you explain that? Please.
Yeah, we have been working through allocating to, I think it's in total around 140 providers between the hospitals and health departments. The hospitals initially had been getting the bulk of the allocations because of the 1A priority group, healthcare workers. We have begun to reallocate that first to a 50-50 split between the hospitals and the local health departments, and we went to a 60-40 allocation last week or the week before toward the local health departments, who we are asking to focus specifically on these vulnerable communities. And since then, we have not made a change to that distribution.
Thank you.
We have time for one last question. Dave Eggert, AP, please unmute yourself, ask your question.
Hi, thanks for taking my question. You mentioned focusing on efficiency, and I'm wondering, is there any state guidance to counties on, whether they should vaccinate county residents? I mean, you're getting a lot of reports of, people kind of driving across the state. They may get an appointment, an hour or two drive away. I guess that's, probably led to some concerns about local county residents being bumped on the list.
I've heard some of those things as well. It's hard to contain or require by county residents. For example, if somebody works in one county and lives in another county, they may get vaccinated in the county in which they work, not the county in which they live. So we are working with the local health departments and the other providers to make sure that they are focusing on getting to the populations that we have emphasized here with the 65 and older and the socially vulnerable and marginalized populations to make sure that we are getting to them first.
Okay, thank you, everyone. We're going to end now, and this recording will be available online soon this afternoon. The strategy document is posted on the web, but I will be sure to send everyone a link to that as well. And if you have any follow-up questions, as always, please send me an email at sutphinl1@michigan.gov. I hope everybody has a wonderful, safe and warm Friday afternoon.